Hi everyone, we'll just start in a moment. We're waiting for Erna to sign in, yeah?
Oh, hi.
Hello! Hi Erna,
Hi, can you hear me?
loud and clear.
Oh, that's good. That's a good sign.
Yep, it works.
Yeah, okay. Now
Yeah,
there are people joining us already.
yeah.
Yeah,
Should we start?
okay.
Yeah. So
Yep,
good afternoon, everyone. I think I'll go over the plan for World Dementia Month first, Erna, perhaps, and
yep,
then after we'll
yes,
go to the main topics on what is dementia. So, good
yep,
afternoon, everyone.
yep,
So, for World Dementia Month, from Dementia Brunei, we initially wanted to have a few roadshows, but unfortunately, as you all know, COVID happened and affected our country. So, we had to change tack. So, we'll be having a few online conversations instead. So, we hope that this will be a bit more informal. We've got 4 sessions. I think we've got every Friday at 3 p.m. With different topics. So, we will just cover the topics as they come along. And then I think there's opportunities for people to ask questions as well. So you can just put on our IG page, and then we will try to get to them as we go along. Or I think there's a way to put comments and questions as well to the IG live thing. So hopefully we'll be able to go through them. And if not, there's always next week, right?
mm,
So
yes,
I
correct.
think the plan is, yeah. Oh, sorry. There's about half an hour or so that we want to talk about what is dementia. So
Mm-hmm.
do you want to do this, Erna? You want to start first and tell us your brief overview about what is
Okay.
dementia, and then add the more
Um,
detailed, boring medical bits.
yeah. So yeah, we'll just do this formal informally. Yeah, for those who is joining us at the moment. And also it's yes, you can ask through our IG as well, and actually you can ask Masani Jola. And our session would be we would like it to be santai saja, so you can ask us any questions, even those yang you all are having macam having thought about it for a long time. Then here is the platform to ask us. All right, so since Dr. Teo has given me the floor, so I'll just try to make this interesting. So anyway, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh, and a very good afternoon to everyone who's joining us on live IG. Thank you very much on behalf of Dementia Brunei for joining in. All right. So Dr. Teo is our president, and myself is the vice president of Dementia Brunei. And yes, sebenarnya Persatuan Dementia Brunei ini ditubuhkan 2018, ya, Dr. Teo. And actually, our vision is for Brunei to be a dementia-friendly community. Tapi ya tani, because probably to some, dementia is a word that they haven't even heard about, Dr. Teo. Tapi it's been in our society. Sebenarnya, let me just explain. Kalau di Brunei, dementia ni it's called lali. Alright, so the definition of lali ni kita ni pun sudah faham. If for example, oh tua sudah ke dia tu, ya lali tu macam tu. So it's always is something very very indah bisai lah untuk disebutkan. You can say it's a negative apa tu namanya, a word to say because it is. alright, because it is. And kalau sekiranya di Malaysia, it is called nyanyok. So di Indonesia is called pikun. So Brunei ia lali. So di Brunei ia selalunya, I think it's everywhere lah ia selalunya dikaitkan with all those elderlies. Alright, so it is macam kalau orang tu sudah tua, macam memanglah ia tu akan lali. Sebenarnya it's not. So dementia ni is actually the actual problem yang mempunyai penyakit ni lah. Sebenarnya it's a penyakit, alright. It's an illness. Penyakit yang menyebabkan kemerosotan dalam fungsi otak kita ni. So whoever yang ada masalah macam mana ni, bukannya lali tu sebenarnya. Sebenarnya ia ada penyakit dementia. So penyakit dementia we have a lot, okay. Tapi yalah, Dr. Teo will go deeply later. Tapi penyakit dementia ni I can say yang paling tinggi adalah Alzheimer's disease. So barangkali Alzheimer's disease yang habis kita selalu mendengar, you know, you don't hear about dementia but you hear about Alzheimer's. Sebabnya Alzheimer's ni, if I'm not mistaken, dalam 80% Dr. Teo So 80% lah kirakan orang yang menghidap. And as ketani, untuk ketani punya pengetahuan kalau dulu-dulunya orang yang menghidap penyakit dementia ni dalam satu saat itu in 8 seconds so one will contract dementia, tapi now it's 3 seconds. So now every 3 seconds orang di dunia ni one will actually mendapat penyakit dementia. So one thing about ketani di Brunei, we are aging cepat as compared to the other countries. So masa ni kita ni tahu the country yang kirakan banyak penua anak is di Japan, but we are closely approaching ke sana juga. So by 2025, Dr. Teo, so probably by 2025 itu kita ni pun will become somewhat macam Japan masa ni. And 2025 is not in any way jauh lagi So this year is 2021. And now because of the second wave, it's like 3 months lagi kita ni kan finish up 2021. It's going to be 2022. So that's why Dementia Brunei is doing all this, and because September is the World Dementia Month, kita Dementia Brunei membuatlah this kind of awareness campaign supaya orang-orang ketanian ni tahu akan dementia ni and then talk about it. Sebenarnya masalah ketani juga, we don't talk about it. So we don't share. And then ketani yang tinggal stres sendirilah So this is kalau you ask Dr. Teo, it's not a good thing to do. Sebabnya sometimes with us having to share it with people and having to accept sebenarnya keadaan orang-orang yang dementia ni, because sometimes family kita ni ada dementia. Our own father, our own mother, grandfather, grandmother, siapa saja. And this does not alien orang untuk mendapatkan. Sama macam COVID sekarang ni. Kanak-kanak pun boleh berlurih. Tapi kalau untuk dementia ni, bukan orang yang berumur 60 tahun saja ke atas akan mendapatkan dementia ni, tapi orang yang lebih muda daripada itu pun boleh mendapatkan penyakit ni. So our worry is sekarang belum lagi sampai 2025 pun kita ni belum lagi very versed about dementia ni. So how do we mengulahkan kita ni, macam mana kita ni approach orang yang ada dementia ni pun it would be difficult untuk kita ni. So now is the time untuk kita ni talk about it. So we know about dementia, and then we have everybody, you know, kita ni satu negara. Macam mana kita ni kan mau menghapuskan COVID ni, cuma tu tahu kita ni kan mau untuk dementia ni kalau dapat kita ni tangani bersama. So we are all in this together sebenarnya. So I think that's an overview of our topic for today, apa dementia. I think later on maybe I can Dr. Teo, tapi I think for the best interest of everyone here, I think probably you can share what is dementia and apa lagi tu specifically in terms of medical view. Yeah. Okay, Dr. Teo. Yeah.
Yep. Thanks, Serna. I just want to pick up on a few comments that you mentioned first. You mentioned that it doesn't only affect old people. That is a very important point. We have a few conditions which lead to young onset dementia. And actually, later on in this month, we've got one of our friends from Singapore, Emily Ong, who has dementia at a young age. She's a mother, she's still working, and she has to cope with this disease as well. So hopefully, sometime middle of this month, we will be able to get a bit more insight from experience. The other thing is Brunei definitely is one of the fastest rates of aging. So I'm also involved in planning services for older people. And so for most of the developed countries, they take about 50, 60 years before the percentage of older people increase from 7 to 14% or become aged. So for Japan, it took about 20, 30 years. Brunei will reach it in about 13 years. So we have a very fast rate, so we have to prepare for it. But of course, dementia and old age is different. Dementia is not related to older age at all. It's associated more as you get older, you have a high risk of getting dementia. But actually, one of the most common confused bits in Brunei, especially, is we don't realize what healthy aging is. So I'm not sure what you are about when you get older, what are expectations of what we can do. But when we have 80, 90-year-olds who are forgetful, they cannot walk, they need help, that is not actually a healthy older person. Our expectation is that when people are even 80, 90, they should still be able to drive, go shopping. So where I worked in last time, we have a lot of older people. They live on their own still. They still go to the shops. They still buy their own groceries themselves. That is actually what we consider as healthy aging. So a lot of this lali, anaknya tua sudah, they will be forgetful, they cannot walk. That is actually one of the misconceptions we have here in Brunei. But I just wanted to go over an overview of dementia. Erna, you just stop me if I get too complicated or too into detail. As I tend to do.
Stop, doctor.
The thing is, the good thing is I don't have my slides, so hopefully it'll be a bit brief. But in terms of the brain, our brain is an amazing organ. So what happens is, as we get about our 18, 21, we have enough brain cells already. Then when we learn, it just makes new connections. The brain is quite organized as well. Different parts of the brain specialize in different things. So for example, one part of the brain, the front part of the brain is involved in personality, planning. The the side bit, the temporal area is involved in language. So when we want to write and we want to read and we want to say words, it's concentrated there. Our memories is right in the middle of the brain, for example. So what happens is, as we get older, the number of brain cells will come down. But there's enough. By the time we reach in our mid-20s, there's enough brain cells. We don't need more. We just need to form the connections. So just like in a country, you have different kampong, you can increase the connections, and then things will become more efficient and they can communicate with each other. Unfortunately, when certain diseases happen, for example, like Alzheimer's disease, so that affects, first, there's some abnormal process in the memory center of the brain. So then we will see a few people, they say, oh, I'm a bit more forgetful. Being forgetful on its own, we all tend to forget things. But these patients with Alzheimer's dementia tend to find that they're getting progressively worse in terms of their forgetfulness. Then sooner or later, whatever disease this is, so Alzheimer's affects the memory center. Frontal temporal dementia affects the language center first. So for these patients, like I had one person come to my clinic, their memory is still good, but they're finding it difficult to say words. They're finding it difficult to read. And so they notice it's getting worse. That's why they decide to get it checked. The frontotemporal dementia sometimes affect personality first. So I had a lady who was a bit more angrier than usual, and then it got worse over time. So that is frontotemporal dementia. The process starts in the front bit of the brain. And then, unfortunately, for some of these processes, because there's an abnormal disease, it spreads through the brain. So, for example, Alzheimer's, they lose their memory functions first. Then after that, when it spreads to the temporal areas, which control the language center, then they find they're also having difficulty with finding words, for example. Then sooner or later, these people will also get changes in personality. They have it a bit more difficult to plan. It's already gone towards the front of the brain, for example. Sooner or later, the ones which are last affected, for example, is even basic functions like swallowing, which is the more core, like we take it for granted, we've walked for a while, we eat since we're little. When it's so advanced, even people with dementia, they find it difficult to swallow, and then they have difficulty with basic tasks like that. I have people with Parkinson's disease and dementia. It's not just the Parkinson's, they can't move, it's also they can't think of how to move the arms and the legs. So we have to try and prompt them and try and help them to do these things. There are several causes of dementia. Erna, you mentioned Alzheimer's and vascular. So Alzheimer's is the most common cause of dementia. But in Brunei, we have a lot of vascular risk factors. So vascular risk factors is like high blood pressure, cholesterol, diabetes. So these things, when they affect the flow of blood to the brain, if it's not enough oxygen or nutrition, so for example, the sugars not controlled, the blood pressure too high damage the blood supply to the brain. They don't drink enough water, then there's not enough oxygenation to the brain. These things will accelerate the risk. So once there's damage, like after a stroke, the decline in brain function becomes a lot faster because now there's an abnormality. So just like my analogy, there's a few cities with highways connecting. So let's say one of the cities damaged. So all sooner or later, all around it, whatever function it is, gets affected more and more, and then soon it will affect and have a domino effect.
Yeah.
So that's Alzheimer's disease and vascular. In Brunei, we have a lot of risk factors. So in Brunei, we suspect about half of them will be vascular dementia. This is different from the developing countries where it's mainly Alzheimer's. So hopefully once we are able to have Bruneians be a bit more healthier, manage all these vascular risk factors, then hopefully we will have less of this. But in terms of prevention, that brings me to an important consideration. For everyone who is 40 years and over, you should get checked every year in your nearby clinic for high blood pressure, high cholesterol, diabetes. Some people don't know they have these conditions. These conditions aren't treated. Then at the later stage, they have a stroke or they come to see us with dementia in clinic. Then sometimes we say, hey, they actually have diabetes. Their sugar's 20 something. Why don't we control that? Why don't we give them a bit more fluids and then we can improve a bit of the brain function? In terms of what we do with these patients when they come into clinic, why is the cause of dementia important for us to find out in clinic? It is because certain dementias are actually, we can give medications to try and slow down the progression, but we need to try and see them earlier as possible before too much damage. The second thing is we try to treat any underlying process that may cause their brain function to be worse. So for example, like I said earlier, one of the patients referred to us for dementia, then they keep getting forgetful, the sugar is high, so that means the flow of oxygen to the brain a bit thick. It's like syrup in a drain. It's not easy to flow. So what happens is rather than a dementia, we found the patient had diabetes, we treated the high blood sugar, asked her to encourage a bit more fluids, and then over time they say, hey, the patient's a lot better. So actually, the whole point is for all of Brunei, we want them to seek medical attention if there's any issues early so we can diagnose. The second thing is even if you're well, you're age 40 and above, you should go to nearby clinic and check blood pressure, cholesterol, diabetes every year, even if you're well, because we want to stay as healthy for as long as possible.
Yeah.
Should I talk a bit more about diagnosis and what they will encounter when they come to clinic, right, Erna?
I think, you can continue.
Yeah, so for clinic, when people have a few of these signs and symptoms of dementia, I think we have an infographic on our Instagram page, which goes over signs and symptoms. It's things like increased forgetfulness, unable to carry out activities of daily living, these sort of things. You should seek medical attention soon. And we usually say to these people, they try to see us in repass, and I say, actually, it is a bit of a wait to come and see us in repass. We will prioritize early, but they should go to nearby clinic. Because we have had some patients have picked up things like folate deficiency, which can make people a bit more forgetful, B12 deficiency, thyroid abnormalities, diabetes, kidney problems. We had one patient who we were asked to see early. They come into clinic, they actually have undiagnosed kidney failure. And so this will cause problems for brain function. So we want the area clinic to diagnose and treat these basic things. Then if they feel that they need specialist input, for example, for younger people below 70, they will refer to neurologists. So the neurologist will do more investigations, they might do a bit more scans of the brain, do a lot more blood tests, because if they diagnose what is the problem, and if they pick up something, they can treat it. If there's nothing to treat, then it's a problem. For the older people, they will come to see geriatrics. And then when they come to clinic, what we do is we find a story of how the dementia has affected them, if it is a dementia, sorry. So we find out what their main issues are, what part of the brain function is affected. We give them a memory test. And so they will have to, we want to see which bits of the brain is affected. We will probably do a scan as well. Then based on what we hear about what they have difficulties in doing, we look at their memory test and we look at which part of the brain is more shrunken. We will try and subgroup them into the different types of dementias. So for example, if it is Alzheimer's, Lewy body, we have medications to slow down the progression. We will talk about risk factors to try and slow down the progression and what other things would be useful for them to overcome the limitations. So an example of a rehabilitative approach. So what happens is these people like disability, dementia is sort of a disability, and they need assistance in terms of how to overcome their limitations. So I had a gentleman he was an engineer. This one is overseas when I was still training as a geriatrician. So this man is in his 70s, and then the wife is quite upset with him because he is unable to carry out basic things. He go to the kitchen, we've had breakfast, then he's like, hey, what do I do now? And so when I did the memory test of him, I found that he's very good in terms of attention to detail. So one of the tests we have to do is draw a clock face, for example. So he draw 3D, very detailed things. So everything he's very good in terms of troubleshooting. It's just his memory let him down. So then if the other aspects are intact, it's just short-term memory, we can overcome that, for example, by using lists. So what happens is I told him and his wife, put a list down. Maybe when he goes to the toilet, next to the mirror, there's like, first you need to go urine first, then make sure you remember to flush the toilet, then after this you brush your teeth, and the steps which are needed, he will have that as a prompt. Then within 3 months, when I saw him again, his wife said he's managing quite well. He just needed a bit of assistance to overcome his limitations. There's another young onset dementia lady who presented at a conference 2-3 years ago. So she gave a normal presentation, actually, like she was a seasoned presenter, quite academic as well. But she actually has advanced dementia. So when I saw her walk down the podium or walk up, the dementia has affected her visual center. So she struggled to see where the steps were because the brain can't take the depth perception anymore. But then she told us this story where when she goes overseas to do a conference, her husband usually help her. The husband will orientate, guide her, and then he will take her to the hotel because she's not easily used to new surroundings. Actually, that applies to all of us. When we go to a hotel, we're like, hey, where is the place to eat and things like that. So he will help her. Correct. But one of the conferences, the husband cannot join. So she thought, oh my God, already promised these people I'll give a presentation. So what happens is in her bag, she labeled everything. And then she's got lists. She numbered her clothes also, she said, so that she can follow step 1 is this one, step 2 is this one, step 3. And then she has assistants or someone to bring her around the place. But things which we take for granted, like getting dressed, getting showered, when they struggle with these sort of things, we have to figure out what is the limiting factor and we have to try and overcome it. So these sort of rehabilitative strategies are quite useful, which hopefully Emily, our guest, young onset dementia guest in one of our conversations will share as well. Anything else you want to add or ask
Yeah.
about that?
I think I can pick up also, Dr. Teo, from what you shared just now. I think in our society adalah yang memang ingawati kalau sekiranya they tend to forget. For example, those simple things lah like where I put my car keys. Di mana aku parking kereta aku tadi you know, those kind of things. Tapi kalau it only happens only macam sekali dua kali, I don't think that is something that they need to worry about. Alright, and for dementia ni pun we have the 10 signs. These are part of it is also forgetfulness ni. Tapi we need to emphasize that the forgetfulness atau the occurrence of it, the frequency, that's what every one of us should focus on. Kalau sekali saja dalam sebulan, dalam seminggu, I don't think that's something to worry about. Ni things that we forget, and then selepas satu we are reminded, and then we forget also, balik-balik tadi lupa dalam masa sejam itu pun berapa puluh kali, then that is the time when we should go for check-up. And I think it's good also to let people know, as you mentioned tadi, jangan taruh sekeripas, because we have klinik-klinik kesihatan yang berdekatan. So for example, if anybody lah, every one of us, we ketani sendiri kah, or we have families or we have friends yang worry about this, then we can ask them to go to the nearest clinic. Di sana tah sekarang diorang will share whatever doubt they have, whatever worries, then probably dari sana they will be referred to either geriatrics ataupun neurologist tadi. I think that's one thing that our people need to remember. And also tadi, I think we also need macam mana Dr. Teo and also who is in live with us, we also need to understand now sebenarnya what we eat is actually important juga. That's why kata Dr. Teo tadi, kalau sekiranya our community ni lebih sihat lagi, it will be probably better for the community to be less having risk of mendapatkan penyakit dementia ni. Because ni personal this is a personal experience on my own, okay? Because I also did not realize sebenarnya apa yang ketani makan tu sebenarnya affect sama ada ketani kan mendapatkan penyakit ni ataupun indah. There's I think we are not educated yang NCDs ni, non-communicable diseases ni sebenarnya penting untuk ketani faham. Walaupun macam Dr. Teo tadi katanya, walaupun ketani sihat dan ada NCD sana, ketani patut jua untuk minta check. Which is, this one is perlu sebabnya we need our brain to function. And then apatah lagi kalau sekiranya we have sama ada diabetes ke ketani hypertension ke, ketani high cholesterol ke apa, it's still yang in the normal in our body. So that is sebenarnya yang penting ketani faham bahawa ketanian ni kalau ada NCD sana, our risk is actually higher to get dementia ni. Alright, so itu itulah disregarding umur-umur ketani. Dah perlu ketani 60 tahun. Macam myself 40 plus probably. Nauzubillah misalnya, I'm not memintalah. You know, but there's a high chance that I can have this disease sebabnya I have kencing manis. So it's a personal journey for me now to understand yang benda-benda semua ni is important. So that is risk reduction Dr. Teo. And one thing, we can speak about risk reduction later, tapi there's a question dalam the chat actually, katanya is dementia irreversible? I think we also need to understand here, Dr. Teo, maybe Dr. Teo can help also. Kalau sekiranya seseorang mendapatkan dementia ni, it is not reversible. And it's actually, dementia ni adalah kemerosotan otak yang akan become progressive lagi. Artinya, memang the damage is there already. So the damage is going to increase over time. And correct me if I'm wrong Dr. Teo, kalau sekiranya a person ada dementia atau our time with that person atau can vary. Tapi we ada dalam 5 ke 10 tahun lah that we can spend with that person until one day ke dia memang lose all function and passed. So apa yang Dr. Teo cakap tadi tu, macam the contoh-contoh about the lady, walaupun ia muda, ia ada dementia, and that guy, walaupun ia steady kena engineer apa itu ini. So what is important is, one is the support system ni mesti important ni. This is the important thing. And then the second thing is kita ni do the intervention atau as early as possible. Sebab atu tahu we want people di Brunei ni to get diagnosed. Kalau sekiranya kita ni, mengapa aku macam mana ni Mengapa aku lepas ku shopping ni aku taruh lauk atu ke dalam almari baju? You know, things like that. Things yang you do tapi it's not the normal thing to do. And remember that dementia ni is not a normal part of aging. So sepatutnya orang yang menua ni, orang tua-tua kata ni sebenarnya ia dah lali. Sebenarnya dah tu istilah lali tu dadak, istilah tu dadak. Tapi kalau sekiranya andang kata ni ada satu tadi risiko-risikonya. Kita ni ada NCD satu, kita ni ada kecil manis kah, penyakit-penyakit lain atau we are benar-benar risikonya lebih tinggi daripada orang lain compared to orang yang ada penyakit. Tapi ya tak, kalau sekiranya kita ni sudah melihat a person or whoever this person is sudah nampak ada symptoms yang gejala yang kita ni katakan ni tu Dr. Teo, we actually have 10. Okay, 10 signs yang perlu kita ni perhatikan. So ani yang important, let me see. Yang 10 ni actually-nya kita ni punya ingatan. Okay, and apa kata Dr. Teo tadi, perkara-perkara yang seharian yang kita ni buat tanpa kita ni berfikir, tapi kita ni dah dapat buat. Contoh, kita ni pakai baju, membutang baju pun kita ni dah pandai. Itu. Alright, and then perkara-perkara yang mudah ataupun kita ni lebih emosi. Macam awalan ni, okey ya Sirna tu. Sekali lepas satu marah tiap. Apaan? Macam marah ya pulang. So, the change in emotion tu, which is very drastic, ini pun adalah simptomnya. Ada orang kan marah-marahan, ada pedah-pedahan ni. And then one thing lagi, one of the signs is also disorientation of time and also hari jam. Macam contoh, kalau sekiranya ini kita ni babu kita ni pukul 2 pagi kan berjalan ya, ditanyakan, ke mana kita mak? Ke mana kita ni? Kan ke kedai punya, kan beli lauk. Mana ada lauk buka pukul 2 pagi. So those are the things that we should look for. Kalau sekiranya we have all this, kalau we have all this worry about people having this kind of symptoms, then kita ni mestilah bawa dorang ni. And yes, it is irreversible. Kalau sekiranya kita ni we cannot reverse it lah. Kalau kita ni sudah ada dementia, then we will have it as long as we live. Tapi one thing because Dr. Teo di Brunei ni kita ni majority kita ni beragama Islam. Okay, and ada bacaan-bacaan yang boleh kita ni amalkan. Sebabnya kepercayaan orang-orang Islam adalah Quran itu adalah penyembuh. Quran itu adalah syifa. Jadi dalam Quran itu pun kita ni kena ajarkan oleh mufti kerajaan kita ni ada 2 ayat yang boleh kita ni amalkan supaya kita ni tu kirakan mempercayai bahawa kalau kita ni amalkan, kita ni akan lebih lagi ingat sebenarnya. Tapi masih ada penyakit itu sebenarnya. So, medical is medical. Dari segi kita ni punya spiritual ataupun perlu kita ni tingkatkan. That's why I say kita ni punya support system itu penting. Kalau orang itu memang ia memang ia suka dengan mengaji apa itu ini, kita ni support dia lagi supaya lebih lagi kuat dalam dirinya. Alright. So, ada lagi question Dr. Teo?
Can I add about the reversible question?
Yes, yes, please.
It's quite important to differentiate between 2 things. One is the structure of the brain. So let's say there's a disease process which affects the number of brain cells, then your function comes down. The second thing is the function of each of the brain parts. So we can actually, it's not just about actually optimize our brain function and how we are able to do things. For example, when Erna says maybe she's lost the keys 1 or 2 times, maybe it's not a dementia, maybe she just needs to clean her house, for example. Do you know what I mean? So we need to try and think about what else is happening that can make this person have this difficulty. The other day, I forgot to reply a WhatsApp text. It's not a dementia. I've got so many texts that day that I've somehow mislooked. Then sometimes when we have these symptoms, it's a sign to ourselves to say, is this right. Maybe we need a bit more rest. Maybe we've just been overworked, for example, that we are unable to function as good as possible. So these warning signs, I would take it two ways. One is it's not just about dementia. It's like, is there a reason why I'm less able to cope or function at this stage? And so the losing the keys might just be, let's try to be a bit more organized. Oh, look, I've got so many things to do. I've dropped down my putting things in my organizer, for example. So let's take stock and then let's see what we can do to make sure the risk reduces, for example. The other thing is sometimes people say when they don't have enough sleep, they're a bit angry or tired, a bit more forgetful. So I heard mothers tend to experience this, like when they don't have enough sleep, there's nothing dementia about that. It's just they need to
Yeah.
sleep a bit more, they need to hydrate, they need to take time to rest and eat. Those sort of things are also important. So I would take the warning signs as firstly, is there something which I can do to try and improve this, even if it is not a dementia? And so that's why
Yeah.
it's very important to share and discuss. So maybe your friends will say, yeah, I think you need to rest more. Then that's the treatment you need. You don't need to come to clinic, for example. So it's very useful to the support system. Talk to your friends. Think about looking after yourself. The dementia, it
Yeah.
is true, you say, we cannot reverse Alzheimer's disease. Our medication that we do will buy time to slow down the decline in brain function. So that one is useful. So when you say 5-10 years, it may give them 20 years of life with slower worsening of their dementia. So whatever is affected by the dementia, we cannot replace, but whatever is left, we can work towards trying to improve the function. And then I think there was another question which I've lost, and
Yeah.
someone wants to join a video call. Should I add them?
Yeah. I think it's okay. So if anybody requests, because we have free slots at the moment, Dr. Teo, I think it should be okay.
Yeah.
The question is there any cure for dementia? Actually, as we've been discussing, there is, oh, that's the person. Okay, maybe we can
Hi.
speak to the person first. Oh
Yeah.
yeah, hi.
Thank you. Sorry, lambat masuk. But we have a few questions on our DM.
Okay.
So the first question is there any cure for dementia?
See, that's the
Is
question.
there any cure for
So there's no cure for dementia. We diagnose, we figure out what might be speeding up their decline in brain function. We have to try and help them decide what we can do to improve in terms of functions to avoid, for example, like the person with memory loss, when we gave him reminders, we can think about risk factors and trying to control those so that the dementia is getting worse. But currently, we have no fix or cure. There's a lot of research going to do that, but so far nothing successful. They've tried vaccination even, but yeah, there hasn't been any. If I find one, I'll be rich. I won't be working anymore, I think. But it is one of the people are looking for. Yeah.
Joint venture, okay. Joint venture with me.
Ba.
If you find a cure. Tapi as we were discussing, we know that now kalau sekiranya orang itu ada dementia, so meaning to say that he's gonna live with dementia up until he passed or she passed. Alright, so itu yang clear lah. Tapi as I've discussed tadi, for those Muslims, memanglah we can do mana-mana yang boleh mengurangkan yang kata ni melambatkan proses dementia itu. So these are the things that we can actually do untuk orang yang ada dementia. The thing is kan, orang yang ada dementia ni perlu kita ni view bisurang itu dengan cara yang sama. Bukan yang kita ni kan ya ada dementia tu, mana berapa pandai tu. Tarang-tarang depan kita ni orangnya, kita ni berkurapak je pasal ke dia. Which is this is not the way that they should be treated. So I think with no cure, tapi kita ni as those yang masih lagi sihat, boleh membuat perkara-perkara yang baiklah untuk disorang ani. So this is what we've been doing, Dr. Teo, untuk pengetahuan everyone here, that we also train people for caring for people with dementia. Tapi sebenarnya dalam kehidupan ketanian ni, walaupun indong bapa ketani tu, siapapun kawan ketani kah, saudara ketani kah, sama ada ke dia ada demensia ataupun indah, ketani perlu je take care arah bisturang ani. Macam mana ketani mengumpamakan bisturang tu, cuma tutah jua ketani mau ia mengumpamakan ketani. They have the same. They orang tu masih ada perasaan. Dia orang tu masih human yang perlu ketani sayangi. Jadi there's just nothing lah. Kalau sekiranya ia ada dementia, yes, ia ada penyakit, tapi that does not defer me untuk that is what we should have in mind. So itu sebenarnya menyenangkan dia. Kalau sekiranya ketani people treat us negatively, would we be very happy and would we want to be with that person? Indah kan? So it's just common sense. Kalau sekiranya orang tu ada dementia, apatah lagi ada dementia tu, sepatutnya dipeduli. Alright? So of course there's no cure, tapi macam mana ketani memeduli bisurang ni is what is important. So this is what we want our society, our community to know. And kalau sekiranya orang tu ada penyakit, dia tak peduli, which is something I think that it is unacceptable. Sepatutnya it's the other way around. So kalau sekiranya contoh, if in a family ada mamanya yang ada dementia, so sepatutnya semua berkumpul anak-anak ni sepatutnya memikirkan macam mana kan menjaga indung ni Some probably aku ni kerajaku bershift. Okay. Some probably anaknya I don't think I can contribute in terms of my time, tapi I can contribute in terms of membalik keperluan mama. You know, things like that. So this is the time when keluarga itu sebenarnya mengukuhkan lagi keharmonian dalam keluarga bisturang sementara indungnya ani masih lagi hidup. You know, things like that. And Dr. Teo, there's a question juga. Kalau sekiranya macam you mentioned about medication. Is it given terus ataupun macam mana? I think it should be explained in our session now. Yeah?
Okay. So what happens is, in terms of the diagnosis, the important bit is diagnosis. All medications have side effects or the risk of getting side effects. So we want to be sure that the people that we are giving the medications to, we call them cognitive enhancers, are the ones which we have the diagnosis which we think it will work for. Otherwise, I can tell you what happened. If people are forgetful, they come to see us, we just give them the medicine straight away. It doesn't work like that. We have to be sure about diagnosis. Then if it is the correct diagnosis, like Alzheimer's, Lewy body, then we will give those ones which we think will respond the treatment. So if the diagnosis is clear from the first encounter, we will give them the medicine straight away. If we're unsure, we want to do a scan first, for example. When the scans come back, sometimes when we see the scan, we're like, oh, I think it's Alzheimer's. I won't wait for their next clinic appointment. I'll just ring them and say, pick up your medication. Like we discussed, this possibility is like that. So you just take the medication early. What are the side effects? For some people, their stomach's a bit more sensitive. So sometimes they feel a bit not right in the tummy, for example.
Yeah.
For some patients, their heart rate slows down. So we have to monitor for signs of that happening. So we'll check the heart rate when they come into our clinic. And then when they come in for follow-up, we'll check those things as well. Most of the time, it's well tolerated. But I say we should be cautious. We give medications only if the need is there. And that's where the diagnosis comes in. Yeah. Otherwise, I say we just give everyone like a vitamin, but it doesn't work like that.
Yeah, because I think some people would bagilah ubat macam tu kan, payah je kami kontrol ni ke dia ni, you know. Probably they would think that way, tapi in the best interest of the patient yang mempunyai penyakit dementia ni, seboleh-bolehnya resorting to medication ni is going to be the last resort. Yep, am I correct, Dr. Teo?
Yeah, if it's not the ones which will respond to medication, we just have to support them and see what else we can do to help them. And optimizing brain function is important. So when you say family have to be involved, we call it cognitive stimulation. So they have to use the brain as much as possible to try and slow down the worsening. So if you don't use that part of the brain, the function will get worse faster. So that's why we worry about the COVID time when our older people, they can't go out, they don't do shopping, they don't use their brain, they can't do exercise, or they worry about it, then a lot of the times people with dementia actually tend to get worse because they just stay in their house, they don't do anything. So it's very
Mm-mm.
important to think about how to trigger or stimulate the brain. And so we
Mm.
used to run activities for older people with dementia in Subok, but because of COVID now, it stopped. That doesn't mean we don't have to do them anymore. Family members should try and stimulate them at home, get them to be involved in tasks. For example, cooking. If, let's say, one of my patients or clients, they forget to switch off the stove, then everyone says,
Mm.
oh, you can't cook anymore. That is incorrect. That means family should be around to make sure the stove is switched off after cooking, not stop the person from
Yeah.
cooking, their brain
Yeah.
function.
Yes. Dr. Teo and also those live with us. I remember seeing a video that was illustrating about how we can actually stimulate and have a simulator at home. So for example, as you mentioned tadi kan, some actually barangkali all our patient with dementia ni barangkali ia suka ke pasar ataupun ia suka balik-balik di Kiangge. This is an example. What I can see from the video is the family members diorang membeli barang-barang itu beforehand. And then diorang susun macam as if it's a supermarket. And then they would say, oh, bahala kasta ke tani shopping. You know, I think those kind of activities can be very helpful masa-masa COVID macam mana lah. When they are masih lagi di dalam rumah, tapi we try to simulate whatever yang ada supaya, you know, the brain function as you say, dapat digunakannya. Because I think bukannya only them yang perlu untuk stimulate the brain, Dr. Teo, but it's actually for us as well. Because we want to, kita ni mau healthy aging itu tadi kan, we should not start at the later age. Sebenarnya we should start now. So I think these are the things. And probably we can say a bit about risk reduction, if we may. Macam mana, Dr. Teo? With risk reduction, we should actually what is important is for us untuk menjaga ketani punya permakanan, yeah. And people need to understand good for our heart, good for our brain. Sebab itu tah ketani jangan ketani take it for granted. Kalau ketani berjumpa dengan doktor, ketani ada contoh kolesterol. Kata doktornya kurangkan yang pemakanan yang masin-masin, yang manis-manis, you know, things like that. I think these advices ni, walaupun they advise it at a regular basis, we should take it seriously. Sebabnya there is always a reason why doctors say it and why doctors bagi ketani Panadol. There is always a reason behind it. Tapi ketani indah, ketani saja balik ke rumah, apa baginya Panadol yang ada baginya. Sedangkan sebenarnya there is always a reason why doctors do that. So I think Dr. Teo, maybe you can say a bit about risk reduction. I mentioned tadi what is good for our heart is good actually for our brain. So maybe you can share a bit.
Yeah. So in terms of prevention, I think there was a question saying what can we do as younger generation to help reduce the risk of our older members get dementia, I think was one of the questions. So in terms of reduction, like you said, the cardiac risk factors, blood pressure, cholesterol, diabetes, these things are quite important. But the other thing is you try to do cognitive stimulation activities to try and keep their brain going. So the main three things which we emphasize to try and slow down the progression is physical activity. So I thought it was funny you mentioned Panadol, because we tend to give people with difficulty with walking. They say, oh, when I walk, I have knee pain. A lot of people in Brunei have osteoarthritis of the knees. Then we say, oh, you take the pain relief and you walk a bit more. Then when they take the Panadol at home, they don't want to take the Panadol. Then they say, oh, my knee is full, I also don't want to walk. Actually, that's incorrect. They should take the pain relief and then they should do a bit more physical activity. For older people, the same recommendations as younger people. So 150 minutes a week of moderate intensity aerobic activity. So it's no different. So I see a lot of the older here, they like to stay at home or family members don't want to take them out. But certainly, I think a few years ago, I asked my parents to go to the beach. I live in Muara, so asked them to go Sarasa Beach and then try to build their physical ability. That one is useful, not just for dementia, we'll park dementia to one side, but just for their general health as well. So for mental stimulation, for older people, it's quite important for them to stimulate their brain. They can learn new things, for example. So like with COVID, it's a good time to get your older family members to use technology. They're like, oh, let's just ask our chuchu to help us with the phone. Actually, we can get them a bit more involved because learning new things is very cognitive stimulation. And so there's apps, they can do a few more things on their phone. I think last time they didn't grow up with our sort of fortunate technology access now. So it's quite a big learning curve for them, but it's very good to get them involved in these things. Maybe they have to pick up hobbies, so you might want to find things to do with them. Reminiscence is something which I'm hoping to look at. Reminiscence is they look back at old memories so that it triggers their brain. So for example, one of the projects I'm hoping to do with my parents is to look at our old photo albums, because we actually have a cupboard full of them and we don't open them. So maybe while we have to stay indoors, maybe that is a good project for us to do, for example, with our family members. So physical activity, mental stimulation, and social interaction. Social interaction is very difficult now with COVID, but certainly you can use FaceTime, you can use WhatsApp video call. So I try to get our siblings to call in to talk to them, for example. We tried last time, and that was so funny. My nephews and nieces were like shouting, excited in the background. We can't hear anything, but then made their day last time. That social interaction will slow down. I think overall, actually, that just sums up what you've said, Erna. We should all just work together and try and get them involved, and quality of life. I think it comes without saying those three things we should do.
And
I think this will be the last questions that we get from DDM. Are there any differences between symptoms and causes of dementia? The difference between symptoms and causes.
Oh, so
that sounds medical.
Just basically just the difference in terms, maybe.
Yeah. So
okay, that's it. You can start first.
On the bright side, we're running out of time. Nah.
Yeah.
So I'll have to supposed to keep it to an hour, but there are three different things actually, not just symptoms and causes. So there's the causes of dementia is the underlying process that cause the brain toxicity, like Alzheimer's, strokes, Lewy body process, Down syndrome. Sometimes they have an early sort of dementia. Parkinson's, there's a toxic process in the brain worsening their movement. It also affects brain function, for example. Those are the causes. And then we think about triggers or precipitating factors. So for example, this one is the reversible bit. So for example, the patient has poorly controlled diabetes. We can improve that, for example. So they haven't got enough sleep. They're a bit malnourished. Let's get a dietitian to see them. So that one is separate to the causes of dementia. That one is the precipitating factors or things which makes dementia symptoms worse. Symptoms are what we see due to the dementia. So for example, if someone has Alzheimer's, first their memory is the most obvious which is affected. Then we just look through what is their limiting factors, what stops them from doing those things. So those are the symptoms. We say, for example, like suddenly they can't drive anymore. Why can't they drive? Or maybe their attention span is a bit limited. Why is their attention span limited? Then we find maybe they should hydrate more. Maybe their visions, for older people, sometimes there's a glare when they drive at night. So maybe even though they have dementia, whatever, maybe they should not drive at night. Maybe they should wear those glasses. There's yellow glasses apparently to reduce glare. So the symptoms is useful because those are the things we actually want to treat. We want people, well, not just the ones with dementia, but everyone to do these functions. So the symptoms are important. Then we think about the precipitating factors, those which are reversible, and then we think about the causes, the more medical bits which we cannot reverse.
Mm.
Hopefully
Yeah.
that makes sense.
How many minutes do we have actually?
3.
We have more questions coming, I guess.
3 minutes.
3 minutes.
I think for the questions, probably we can bring it forward to next week. But
Yeah.
I would like also to share before we go off that probably some would think that dementia ani because it's an illness that it's a medical problem saja. Artinya ani masalah Ministry of Health ni. No, as we see, COVID ani pun is not only entirely a problem that MOH should actually handle, but it's actually semua. So it's the same as dementia. So dementia is actually a medical and also a social problem. All right, so it affects both of this. So I think we need to understand that dementia ani is not only atau problem mu tu. No, it's actually our problem sebagai satu country lah. So actually we need to work together on this. That's I think that's important job for people to know today, Dr. Teo and whoever is live with us at the moment. So we bring this back and then bis kita pun boleh ceritakan arah kawan-kawan bis kita. And as a reminder, maybe you can do a bit of housekeeping. Siapa namanya ni? I forgot her name.
Oh, okay.
Oh no. Okay,
so
you
for
do
our next weekly online discussion, we're going to have it on Friday, every Friday. Sama juga, jamnya every 3 in the afternoon. And the topic will be communication for person with dementia.
Okay.
So you can drop your questions. Our followers can drop their questions on our story or just directly DM us.
Yes.
We will share during the meeting live.
Yes. Anything to say, our president?
It as usual, like we have so much to talk about, but then time always gets the better of it. It's been sharing, and I think I'm sure there'll be a few more conversations or questions. So happy to try and help you guys answer those.
Yes.
And thanks for joining.
Yes, thank you, Dr. Teo, and thank you, dearest.
So with that, we'll probably wrap up then.
Yep, that we wrap it up. So thank you very much, everybody. Assalamualaikum.
Thank you. Salam.